welcome back to Talks with the Doc Brown. I'm Aurel Jackson and I'm here with Dr. Christopher Brown, the founder and visionary behind thedocbrown.com. Today we're back again and we're talking more about kidney basics, and today we're going to focus on Kidney 102. Welcome, Dr. Brown.
Thank you.
Okay, so I've got questions for you today. So we're going to go a little more in detail about kidney disease. And so you told us last time where they are, a little bit about how they work. But today I wanted to ask you some questions that I've heard from patients where they want to know about what happens when your kidneys aren't working properly.
Okay.
Can you tell us a little bit about that? And especially one of the things I've heard is people refer to kidney disease as the silent disease. Can you give us more information about that?
Yes, thank you for that question. I'm glad that you asked. I get asked this question a lot. So yes, the kidneys, like a lot of other organs, can all take on damage in various forms. And as you mentioned, one of the things about damage to the kidneys is that it often goes without a lot of signs or symptoms. One can lose a lot of kidney function without showing any symptoms at all.
Okay.
It's not uncommon that in my clinic, a person will come to me and they will have a kidney function of only 20% and feel absolutely fine.
Okay.
So the thing with kidneys is they are able to take a lot of damage, and until they reach the end, you just won't know. So kind of like hypertension is a silent disease, kidney disease is also a silent disease.
So that's why it's really important to know if you're at risk for kidney disease, right?
Yes.
Because there are some groups that are more at risk.
Yes.
And I know we're going to talk more about that in later videos and articles. So can you tell us maybe, are there some warning signs, and what are those warning signs that you may have kidney disease?
Okay. So some of the things that may show up if you have kidney disease are high blood pressure, if it's new onset high blood pressure, or if you've had high blood pressure for a while that all of a sudden is very difficult to control, that can be a sign of kidney disease. Also, if you have swelling, especially swelling in the lower legs, and if they find out that you don't have any issue with the heart, sometimes that can be a sign that the kidneys are not getting rid of as much water as they should. So those are kind of the big things that are there. Now, if we get into what we call advanced kidney failure, sometimes those people, they'll get tired, they can't eat properly because interestingly there's something called uremia, where a person doesn't really want to eat meat, and if they try to eat meat, it tastes like metal. So these are some of the more common signs of advanced kidney failure.
Yeah. Okay. So would you sometimes maybe find blood in your urine or protein in your urine?
So yeah, so one of the things that happens is that if you have a suspicion of having kidney disease, your clinician may order certain tests. And these tests include blood work, where they will measure something called creatinine, which is something that your body makes every day, tries to get rid of every day. And the more of it that's in your blood, we know that the less your kidneys are working. They actually turn this into something called a GFR, glomerular filtration rate. And that GFR really is kind of a measure of kidney function. It's an estimate. And the lower that number is, the worse your kidneys are doing.
Okay.
When they do the urinalysis, the urinalysis is looking for blood, as you mentioned, and also protein.
Okay.
These can be a sign that the kidneys are damaged and will need further workup.
All right. Now, I know we're going to cover in much more detail the whole issue of understanding your lab value. So that will be when we talk in more depth about that, right?
Correct.
Okay. So now the other question that I've got is, what about if you have to get up a lot of times during the night to go to the bathroom? Is that maybe a sign of kidney disease?
It can. Sometimes if you're getting up a lot in the middle of the night, it can be a sign of kidney disease. Also, if for some reason you're not completely emptying your bladder whenever you go, that urine can back up and actually damage the kidneys.
Okay.
So if you notice this, especially all of a sudden, it's very important to go see your clinician.
Yeah. Okay. So we do have more information in the web article, and also some links to other websites where there's additional information. But I think that sort of wraps up the conversation for today. I know you want to tell them what you always want to tell them.
Exactly. Yes, that wraps up everything for the day. Thank you for tuning in. And as always, I like to tell people that I'm a doctor, but not your doctor. Please go to your physician, nurse practitioner, or physician assistant for more information about your kidneys, especially as it pertains to you.
That's great. Well, I hope you all come back and join us for more on Talks with Doc Brown. And don't forget to comment and tell us what else you'd like to hear us cover in these conversations. Thank you.
Thank you.